I want to talk about chronic pain and physical therapy and how usually pain is treated and how we should be start treating the pain in order to see a positive impact and changing our patient's life and their symptoms. What I'm going to share is my own experience working with patients who suffer from chronic pain and working in different physical therapy settings. I hear patients many times saying, I have been doing your exercise, I have been doing my stretches, using the ice, the heating pad, and the pain is still there. I don't see the improvement that I really want to see. The problem is when we as a therapist, we only treat the pain as a physical symptom. We only target one body part in specific. Remember that chronic pain is something that has been in our body, we're experiencing for 3 months or longer. So meaning that something else in our life is happening that is impacting negative that symptom, that body part. So one of the things that I recommend as a therapist, and I have been implementing that on my own, is being more an empath and connecting more with the patients in other areas. We need to understand that pain also can be emotional, can be spiritual, can be due to chronic stress, mental fatigue. So when we're trying to dig a little bit deeper in the patient's life, and I'm not meaning, and I know we are not psychologists, we're not therapists, we are not counselors, but we're humans. And as a humans, we just need to be an empath and understand life is difficult. We're going through different challenge. So if we're trying to ask questions like, how's your life? How are you doing? How is work? Is there anything else that maybe is causing a little bit stress in your life? It's gonna help us to put the pieces of the puzzle together and also maybe manage that and allow the patients to have room to express. We need to be mindful listeners, and the patients need to have the room to talk, to express, to say whatever they want to say, because that is going to help us in our plan of care. And it's going to also improve the relationship patient and therapist, or patient and caregiver. So it's really important that we start creating that connection and allow ourselves as a therapy to also go a little bit deeper in our own settings. So that's my experience, and since I have been implementing this in my own patients, I notice how they can open themselves. I notice how they can create self-awareness, how they can manage their own symptoms and be okay with what they're feeling, where they are right now, but able to learn techniques that's going to help them to improve also how they feel and where they want to be. So that's my recommendation, not only for the therapist to create a deeper connection with the patient in the emotional and the spiritual area, but also to the patients to start having room to express themselves, not only with the physical therapist, but also with any healthcare provider. Just allow yourself to talk and mention, how do you feel? What else is going on in your life and how you want to be treated? So I hope this helped, and we need to start changing and creating a different way to treat chronic pain and go into a more holistic way to see mind, body, and soul.